Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff, and tonight we're joined by Dr. Ken Davis, who is the Chief Medical Officer of Christus Santa Rosa, along with Dr. Anita Kurian from San Antonio's Metro Health. This is our COVID-19 update for the San Antonio community. For everyone who heeded the warnings this weekend for July 4th, we want to say thank you very much. We are in the middle of a great fight against this coronavirus, and for those of you who joined in that effort to protect our neighbors, we appreciate your work to protect each other. Remember, stay home if you can, wear a mask if you can't, and keep 6 feet of distance from people outside of your household. Let's go into the numbers for tonight. Today we're reporting 351 new cases of COVID-19. That brings us to more than 15,000 cases in our community since this began. The total is 15,102. Unfortunately, we also do have 2 new deaths to report tonight, a Hispanic male in his 40s who passed away at University Health System, and then a Hispanic female in her 60s. This is on top of the additional 8 deaths that we reported yesterday, bringing the total from in our community from COVID-19 to 132. Remember, these are mothers, fathers, brothers, sisters, uncles, aunts, neighbors, and loved ones, and our deepest sympathies are with them and their families. This is taking a human toll on our community, and we have to be mindful of that as we work together to contain this virus. We do have now in our hospitals 1,168 people hospitalized, with 382 in the ICU and 213 on ventilators. That's an increase from last night of about 16. We now have 51% of ventilators available for us, as well as 12% of staffed hospital beds. The team of health professionals is also monitoring, as we do it weekly, our progress and warning indicators, and they had their weekly meeting today. Not much has changed in our indicators this week. New case numbers, patients in the hospital, the percentage of positive tests, as well as stress on the hospital systems all remain in the red. I want to point out a few things, though, and you can see these indicators at covid19.sanantonio.gov. Our epi curve, which is the curve of infections, is starting to show a slowdown in the acceleration of cases. This is significant because, as you know, for the last couple of weeks, we've had a mask order in place, and people have been really heeding the warnings that our hospital system is under significant stress as we've seen a surge in these cases. Keep doing that, and hopefully we can bring these cases under control. In addition, we have increased now the testing available in our community to over 7,000. That's also a step in the right direction. With regard to positivity of tests overall, we stand at 11.9% since this pandemic began. So that is another marked increase, which is not good in terms of the positivity weekly. Last week's positivity rate of cases was a full 22%, and our doubling rate of infections remains at 11 days. I'm going to turn it over now to Judge Wolff.
Well, a little ray of hope. Again, I want to also thank everybody for being a lot more careful. I see it myself when I'm out, and you hardly ever see anybody without a face mask now, but it takes a while to have these sort of things come into place, a good 14 days. So we've had it now for 2 weeks with employers, for just a few days with the governor's order, but we're slowly but surely we're beginning to see a little of improvement, but we're not sure yet where it's going to be. I did issue a new executive order today canceling a foreclosure sale that was going to happen tomorrow. I was able to do that because the governor on July the 2nd limited outdoor events to 10 or less. That gave me an opening to be able to stop the foreclosure sale, so it will not happen tomorrow. It's postponed to August the 4th, and then that's dependent on what the conditions of the community is like with respect to the coronavirus. Let me give you a little hint of what I'm doing. It may help you. In the morning when I do go for a run, while I'm running, I take 3 deep breaths through my nose and then exhale. And the reason I'm doing that is because more and more reports are showing that your nasal cavities produce a molecule, nitric oxide, that increases blood flow through the lungs and boosts the oxygen level in the blood. And breathing through the nose delivered directly to the lungs helps fight coronavirus infection by blocking the replication of the coronavirus in the lungs. So just a little hint that you might want to practice on, breathing through the nose and exhaling through the mouth.
Thank you very much, Judge. And again, thank you to everyone who is heeding the warnings of our health professionals and wearing of masks, maintaining physical distance, doing all the things that we know can help fight this infection. If you would like the latest updates, you can subscribe via text to 55000. Just text COSA.gov to 55000. And also, you can go to our website anytime for the latest at covid19.sanantonio.gov. As I mentioned, we have Dr. Ken Davis here, who's able to answer questions along with Dr. Anita Kurian. And let me just thank Dr. Kurian and her team at Metro Health. They've been working extremely hard for the last 150 days now. We're at 150 days since the first plane landed, and we were working with our entire community to ensure that we are bringing people home safely. And then, of course, now we are here with regard to our own response here in the United States. But thank you to all of the health professionals in our hospitals, our nurses, our techs, our EMS personnel working extremely hard. And thank you to you at home who is listening to the warnings and heeding the advice of our public health professionals to protect our neighbors and save lives here in our community. So with that, we'll go to questions.
Dr. Kurian, would you say that we have reached a plateau when it comes to this peak?
It's difficult to say. Like Mayor pointed out, in the epi curve, we are seeing a sustained decline. I don't want to say sustained decline. We are seeing a decline. It remains to be seen if this decline is going to be sustained. But until that happens, it's difficult to say if we've reached a plateau.
When would that be? How many number of days?
If we continue to see for another 2 to 3 weeks a sustained decline in the number of new infections, then we can assume, we probably can safely assume that we've plateaued, but it's too early to say that.
Can you talk about the hospital beds? How are hospitals looking? I know last week it was a pretty dire situation.
Well, I'll go and answer that with the data that we have, and then, Doc, if you want to fill in the blanks. It's not any better. In fact, it's worse, simply because we have more patients in the hospital. Tonight, we were reporting 1,168 patients in the hospital. I mentioned 382 of those are in ICU and then 213 on ventilators. We have 12% of staffed hospital beds available. So we are days away from overrunning our hospital system if people don't continue to work together and slow down the infection.
Well, our hospital stress scores are still high. Fortunately, we've had support from the state and the federal government. They're sending nurses and respiratory therapists and ventilators to us. Without that, we'd be in a much more dire situation than we are. So adding staff from the state and feds has helped significantly.
Can you say how many people have come in to help, how many nurses, staff, et cetera, and where they're coming from?
Well, I can't give you the exact numbers, but we have 100 Navy nurses who were here this last night. We've had 85 nurses from the state coming in, nurses and therapists coming in from the state. I think the total is going to be about 350 before it's over with. About 250 will be here this week. So we need that level of support.
So last week, I think STRAC had reported out that 250 nurses would be coming. They've put out a request for 250 nurses from Department of Defense and 565 nurses from Texas Department of State Health Services.
So last week we heard that we had some members from the Navy coming. We saw today that through FEMA's request that we have some from the Army, from Colorado coming. So is it all different branches of military, and do we have an exact number in terms of the military support that we're getting?
I don't have that number other than 250 nurses requests have been made to the DOD. So they probably are coming from different branches.
And these nurses are going to our hospitals and just helping. I
Correct.
mean, we're talking about all walks of life in terms of what they're going to be doing, right?
They're being distributed to the hospitals, primarily intensive care is where the need is.
I want to talk about, too, yesterday with the city, or over the weekend, the city changing the terms of its testing. Let's remind the folks today on this Monday that if you are not showing symptoms, you cannot be going to these free testing sites. Why the change in the middle of all this?
So there are over 50 locations county-wide or city-wide for testing. Not just the free sites that are manned by the city, but there are several more testing locations on the private sector. And what we were finding was the free testing sites that were manned by the city, we had a lot more folks. And this free testing sites manned by the cities are primarily intended for folks who don't have insurance or uninsured. Folks with insurance should be going to the private sector or their doctor's offices to get tested. What we were finding was there were folks with insurance showing up as a result of us having to turn folks away from these free testing sites. So in order to accommodate the exceedingly large demand at these free testing sites, especially among our uninsured and underinsured folks, a decision was made to prioritize testing primarily for symptomatic folks.
I think that was a very good decision y'all made.
Yes, and just because we made the decision doesn't mean we are not recommending testing, criteria. We are recommending testing criteria to be changed to the private sectors. They can continue to get tested there.
Some people that did have symptoms may not have got tested that day because of the jammed up line, and according to Chief Hood, that some people were abusing it by getting several different tests that
Exactly.
again bogged up the line.
And there has been various anecdotal evidence that folks with symptoms from the city were driving all the way up to New Braunfels, even Austin, to get tested.
Oh, that's bad too. Well, I think you made a good decision.
And let me put it another way. No one should be turned away from a test. There are many people in this community, though, who are only able to access those free testing sites because they don't have an insurance. So if you don't have to go to a free testing site, leave it for somebody who needs that free test, and that's the goal of all this.
And this,
Curian, can you talk about how important it is for those people that do have insurance? Do they have to pay out of pocket to do that? I mean, if they have insurance?
I think insurance covers for testing. I'm not sure if there are any copays associated with it, but this is covered by insurance. Testing is covered by insurance.
as Mary just said a few minutes ago, that our testing capacity is now at 7,000, right, which is new. Do we want to get that to a certain number? We've asked that before, and I don't know if we've ever gotten some
Yeah.
type of ballpark figure, but, the idea back then was to get more people tested, so.
Yeah, our health transition team recommendation was 3,000, and so now we're at 7,117. So, I think the goal, and I don't know, Dr. Kurian, if you can clarify this, but I think the goal is to make sure that we have enough testing to meet the demand.
Especially the demand of those underserved population.
Right.
We have a text question from Ryan Medina. KENS 5 received an email stating the sheriff's office employees who are positive and later return to work should not be tested again because no matter how many times they test, it will never be negative. Does our local health authority agree with that theory? And according to our current understanding of the virus, can someone who has had COVID-19 get it again?
So the first part is somebody who's tested positive, should they get tested again? And the answer is no, because once you test positive, we have documented evidence of virus remaining in your body for up to 6 to 8 weeks. So if you continue testing on weekly basis, there is a high likelihood that you will continue testing positive. Just because you tested positive in those 6 to 8 weeks doesn't mean you're infectious. So our recommendation is if you test positive, refrain from testing on weekly basis or do any serial testing. The second part was. I'm sorry, what was the second
Can
part?
someone who has had COVID-19 get it again?
We don't know that for sure. We believe we don't have concrete data or evidence about reinfection or immune from reinfection. So we don't know that for a fact. But I can tell you based on the cases that we've seen and the data we have not documented a case of reinfection just yet.
A couple more from Mariah. Who is guiding the testing strategies at the jail? And has anything changed in recent days about COVID-19 testing performed at Bexar County Jail?
Well, we're testing people as they come in. As you may remember, we went through the jail and tested everybody. And once we finished that, then we started doing it as they come in, and which is a much better system to do. You got to remember the jail is a revolving numbers, not like a nursing home. We may have 2,000 people come in one month and 2,000 go out. So we test them when they come in, isolate them if they are positive, and segment them away from the other population. They've really done a good job. Dr. Ruth Bergman has been our guiding light in how we run the jail from her advice, and she works with Metro Health. We're in good shape there now. We only have a total of 58 inmates, 59 inmates, I think is the latest number I got, that are positive. We only have 6 in our infirmary, and we have no one in the hospital. So they've really done a good job.
Dr. Davis, while we have you here, if you can, the mayor just said that we're days out in terms of our capacity, just to kind of get you and your thoughts on that. And in terms of, the staffing that we have, that issue, obviously we have more help coming in. If you can just elaborate a little bit more on that.
Well, it is very fragile. At a 12% capacity rate, it takes at least 5% capacity to move people in and out. So we're tight. We're holding people in the emergency rooms. All of our systems are. And if you have a heart attack or you're coming in a car wreck or something, we want to make sure we have the capacity to manage you as well. So we're very tight, especially for this time of year, which is typically a lower time of year. This virus is not abated during the summer as we thought. So we're managing it. We're hopeful that the curve may be changing a bit thanks to what the community is doing. That's the major driver of that. But we have the capacity right now to care for people. We want to maintain that.
Mayor, Judge, was there any indication, any numbers you can share as far as citations that were given out for people not following the orders this weekend?
I can get the numbers up to speed, but we did cite and we shut down one business. In fact, a bar that was operating illegally, we shut them down over the weekend.
Do you know what bar that was?
I don't. I can get that name for you, though.
It was a local establishment?
Yes.
Okay. Mayor and Judge, if you can too, I think just even some message of hope. You said 150 days. I mean, that number, when you said that seems so long that we've been in this, and the fact that we're not over. So, I mean, it's just been a long fight when you say 150 days that all of us have been in this, and we still have to continue in this fight.
Yeah, and this is a marathon, not a sprint, and one element to winning that is that people have to get used to some of these minor inconveniences that actually end up having huge impact in saving people's lives. We shouldn't be complaining about putting a face covering on if it means that one more mother or father gets to see their children again. We shouldn't complain about having to sit a few more feet away from the table next to us if it means that we get to enjoy some more activities that we thought we wouldn't be able to. So things are going to have to change if we're going to live with this virus until there's a vaccine or some better therapeutics, and we have to be willing to do that for a long time, months, if we're going to enjoy life again. And that's the part of this. We've got to have some endurance, we've got to have some focus, and we've got to make sure that we're all doing this together.
You got to remember what blew this apart. People became very, very careless. Mixed signals were given out by the President of the United States, by the governor, and young people, flocked to the bars and brought it back home. And so now I think people understand what we're talking about. Now it's bipartisan support for the mask when the governor changed his position, which we're delighted that he did, sending out a consistent message now. But as the mayor said, this is a marathon. We're going to be going through the summer, then we're going to get to the fall, and we don't know what's going to happen when we get to the fall. So we're going to have to learn how to live with these, I would say, like the mayor said, minor changes. Maybe, like he says, to the first of the year or till we get the vaccine. It's not that terrible a thing to do.
Thank you.
Thanks, everybody.